Thank you for joining us today. I'm Adrienne Griffith, Clinical Director at Southeastern Plastic Surgery, and I will be your monitor for this event. We are live streaming on Facebook as well as YouTube. This hot topic will be saved on both and can be watched again at a later date as well as shared, so you can do this at your leisure. Please submit any questions that you may have during the presentation, and we'll be happy to address those immediately at the conclusion of the live stream. So add them in the chat and we'll be happy to address your questions. Let's get started. Today's hot topic is facial rejuvenation. Dr. Kerbo is the founding partner of this practice, along with his partner, Dr. Rosenberg, had a vision to meet the needs of this region. We'll continue to celebrate over 20 years. I'm sorry, we're having a little bit of reverberation with our sound. I'm going to pause for just a quick second and we'll get that solved for you. There we go. So we're going to continue to celebrate 20 years of serving the community, which will include a unique twist on our holiday celebration, and we'll give you details on that a little bit later. Please remember, jot down any questions you may have as they come up during this presentation, and we will address those at the end. We know facial rejuvenation is a topic that can cover many procedures, both non-surgical and surgical. So we're excited to explore all those options with you today. And my first question is for Dr. Rosenberg. For the men and women out there, Dr. Rosenberg, who are looking for a place to start and are not really wanting surgery, what is the best non-surgical procedure to give the patient a rejuvenated look? In other words, are there options out there for people who would like to, say, resurface the texture of their skin or tighten the skin, but are not yet ready for a facelift? What would you say?
Sure. Well, I think a lot of people start off with something called Botox or filler, and those are types of injectables that are non-surgical, probably the most common non-surgical options for facial rejuvenation. And then moving up the ladder, peels are a common type of procedure that is not invasive, but is very popular and can really give a nice resurfacing and kind of restore a youthful appearance to one's face. I think we have some slides to show you about the different types of peels that we offer at Southeastern Plastic Surgery.
Okay.
So we generally perform phenol peels at Southeastern. We occasionally do TCA peels. They're very similar in that they're both chemical peels. The phenol peel can be a more deep peel than the TCA peel, but it also can be a more superficial peel as well. And so there's a lot of overlap between them. These are very good for resurfacing the skin, removing both superficial and deep lines, and taking care of getting rid of sun damage. And it actually also has, to some extent, a skin tightening effect. These are outpatient procedures that are performed. There is some downtime associated with it, but the recovery is generally fairly quick and is not doesn't require incisions or scars to be placed on a patient's face. Next slide. This is a lady in her 40s, and it's tough to tell in this picture, but severe sun damage and lines. And she just underwent a phenol peel. Next slide, please. You can see from the side, especially on her cheeks before and after, just how much of an improvement you can have. She was supposed to have a second peel on her chin. You have to be more careful on the chin. And so I usually will do 2 peels for such severe damage on the chin. But she was so happy with her cheeks that she didn't feel like it was necessary. Next slide. This is another lady who didn't want to undergo a facelift, and that would have been another option. And we'll talk about later how people do have both of them performed. But you can see her before and after, how much it's improved upon the lines on her face, the sun damage, and it even makes her face look more slender. She didn't have a facelift, she didn't lose weight, but it almost makes her face look much thinner after she's healed. Next slide, please. And you can see from the side as well, just the significant improvement that there is to the tone and texture of her face. Next slide. This is another lady who also underwent a phenol peel, just lots of sun damage and lines. And she just wanted to feel better about herself. I believe her daughter's wedding was coming up. And you can see this is a little bit of a tricky picture because she does have makeup on afterwards. But you can, even without it, you would see a significant improvement in her overall appearance and just kind of the softness to her skin. Next line. And then here she is from the side. Next slide, please. This is a lady who had a lot of sun damage and she had lines from acne scarring. And she did not want a facelift either. She just wanted skin resurfacing. And here you can see her before and after. Next slide, please. And you can really see the difference on her cheeks, just how much better there's tone and texture. Those deep lines just past the corner of her mouth are gone. And her skin just has a much better appearance to it. It doesn't have all the sun damage and pigment issues related to growing up in South Georgia. Next slide. Next slide.
Nope, that's it.
Thank you.
Okay. Dr. Curbo, if you have a patient who is just beginning their journey to a more youthful appearance and good skincare treatments, you know, we've got our own regimens here that we can recommend. What would you suggest for them to be a good jump off point?
Right, this is always pretty fun. So I think you know what Lawrence is addressing with the peels is one factor in the aging face, which is environmental aging, whether it be sun damage, social habits, you know, diet. So there's a lot of things that can affect the surface or then cause environmental damage to the skin. And so that's really what those phenol peels are addressing. And you can see with his excellent results, they're just some great changes. But I really think if people are conscious about it, starting even earlier with just some lifestyle changes, such as not smoking, you know, watching out with the sun damage, UV light, their diet, lots of fluid, water. And then I do think, and we see this really in these phenol peel patients, we get them in a medical grade skincare program before the peel. To me, that's one of the most important parts of it. And many times they come in for their peel that day to the surgery center, their skin already looks so much better. And I think that sort of can begin that part of their journey. But I do think that starting even earlier, just in changing lifestyle and little things we do will help. You know, a lot of these patients that Lawrence was showing, you start talking to them, they either grew up in South Georgia, you know, they were working on a farm when they were younger and all this sun, or they were in South Florida, or, you know, so really being conscious of that with as young as you can, I think that's real important.
Mm-hmm. Dr. Rosenberg, a couple of questions for you from our audience is one, what is the downtime usually for a phenol peel? And does the phenol peel take the place of a facelift?
So good questions. It depends on the depth of the peel. On average, if it's a deep peel for really severe lines, it's going to be about 2 weeks of downtime. Usually by about 7 to 10 days, you're just red, but you're still really red. By 2 weeks, that redness you can cover up with makeup. But I generally tell patients 2 weeks of recovery, but most of that time has just spent protecting your skin, staying out of the sun, but you're up and about and doing your normal activities.
Okay.
I do think that a lot of people benefit from having both a phenol peel and a facelift. I think they kind of address two separate issues. The facelift is more structural and the phenol peel is more superficial. And so we definitely see a fair number of patients who, you know, elect to undergo both, and it really, they're quite complementary to each other.
Excellent. Dr. Curbo, would you have a preference to determine if somebody wants to do both a phenol peel and a facelift, one, whether or not they're a candidate for both, and would you have a preference for the order that those procedures be done?
I mean, I don't know if I would have a preference for, the order. Again, that phenol peel addresses one of the causes of aging of the face.
Mm-hmm.
I don't know what Lawrence thinks about this. I tend to think I think if I had my preference, I would probably do the facelift first and then follow that with a phenol peel, because the skin itself is going to be, the position is going to be changed a little bit. Some of the finer lines or lines may be different in a different area. The treatment may be a little different. So that's what I would probably, if I had my preference, that's what I would probably do with those patients. Then
Okay.
the phenol peel can also address any scars that could be a little problem for them if it's something bothering them.
Mm-hmm. So would you like to give us your presentation on facelift and neck lift at this time?
Sure.
Okay.
So, what we're trying to address in this talk, and there's just so much that goes into facial rejuvenation, from, as Lawrence said, from Botox to fillers, and we're sort of focusing a little bit more on the surgical side of it. But what I tell patients, that there's really three things that age our face: the environmental changes we see, loss of volume in our face. That's been well documented over imaging studies. And then gravitational descent of sort of the deeper structures, the structural anatomy that Dr. Rosenberg was alluding to. And so when we start talking about neck lifts and facelifts, we're actually making incisions. We're really beginning to address and go into a little deeper of those causes of facial aging. So, and that comes with surgery and with a scar, but it can also be a complement to the environmental improvement we do with phenol peels, and or really address some of the problems that fillers and phenol peels can address. First slide. When people come to us concerned about the aging face, there's really, I think, most common areas they're worried about is the neck and the jawline. And when I say jawline, I also include the jowling area. Now, again, that's not loose skin that's just falling there. That's the descent of those deeper structures. And that's why simply doing something with the skin is not going to solve the problem, at least long term. Next slide. So in our practice, there are different ways to address the neck and the jawline. And sometimes the line between a neck lift and a facelift is a little blurred, because those deeper structures are all connected. You often need to address all of it. I sort of allude to, if you have a comforter on a bed and there's a wrinkle in the middle of it, you can pull out that one wrinkle, but by really, taking one end of the comforter and pulling it tight, you really smooth out the whole sheet or comforter that's on the bed. So sometimes just addressing that single area of descended structures may not be what the patient needs, or it may not help them. But so different patients may qualify. For instance, this patient here who has some mild jowling, but really her issue, which bothered her, was sort of the loss of her neck. You can see that chin sort of neck angle is sort of gone. She's relatively young and she has good skin quality. So in this patient, we can go through just a small incision in the neck and tighten those deeper structures in the neck, do some liposuction, and rely on the skin to help us out. Although this isn't meant to address the jowling, you can actually see a little bit of an improvement in her jowling. But what you really notice is the deepening of that sort of jawline angle. And so she has a nice result. That's all done through an incision just under the chin. There's no incision around the ear or your typical kind of facelift incision. Next slide. This is another way we can address the appearance of the neck. This is an older woman who really only thing that bothered her was really her neck and the banding you can see of her muscles there. It's not loose skin. Those are the muscles that have sort of fallen, and they give us that look of loose skin. And this is what we call a direct neck lift. It's very rarely we do this on women. We mostly perform it on men. But there are certain women that may want to do this, and it may be acceptable to them. So this is done through an incision along the neck, where not only do we tighten the skin, but we're tightening those deeper muscles under there and sort of eliminating that banding. So you can see the real nice change she has from her profile. Now, not many women would be tolerate a scar on their neck, but you can see this woman has done very well, and was she understood that that's what she would have, and it's been very acceptable to her. Next slide. This is more of our typical sort of neck lift that we do, direct neck lift. It's generally a male who comes in who's otherwise in nice shape. They don't want to have a facelift. I don't necessarily blame them, but they really want that neck to look more youthful. So on men, it's very acceptable, I think, to go in and do what's called a direct neck lift, where we go in again. Yes, we're tightening some skin, but we're really addressing that platysma muscle. That sort of waddle you see hanging down, that's the muscle, and it's sort of pulling the skin with it. And so by going through this incision in the neck, we're tightening that muscle and then tightening the skin a little bit. It's not meant to do anything with the jawline or the jowling, but you can see it does improve that jowling a little bit. And for a man, that scar down the middle of his neck is very acceptable through his shaving and the beard. That scar tends to do very well on men, and it's usually very acceptable to him. Next slide. This is a whole nother extreme of what we see in neck. Here's a gentleman who has a little component of everything. He has a lot of subcutaneous fat, as well as those deeper structures that have fallen. And, his complaint was he had a hard time even wearing a shirt and a tie. He's a professional. And so this sort of combines a combination of liposuction and, again, tightening that muscle through that skin excision. And then the result is, an improved jawline and that chin neck angle. And again, the scar on the midline of the neck to a man like this, and that result is very acceptable to him. Next slide. And here's another, again, same thing. We're not doing anything on the face proper. This is all done on the neck, and you can see the nice change in the jawline. This is a little younger gentleman, and it's a little more subtle change, but it makes a big difference for him. And the nice thing about these procedures is the downtime is relatively easy. We do this under a general anesthesia. It's about an hour and a half surgery. And most people are back, driving in sort of in their normal routine within a week. So it's a real nice procedure for this particular problem. Again, it's addressing those deeper structures that have pulled the skin with them. Next slide. And that's it. So many times, though, when that connection of those deep structures needs to be handled in a more uniform fashion, that's when we begin to go and talk about doing more of a formal facelift. So if we go back to the slides, you'll see we can show you some examples of more formal facelifts that begin to address all the properties of aging, the deeper structures, descending, and then many times replacement of volume. So here's a typical patient we see who is concerned about their jowling, their squaring of their face. They're concerned about the banding in their neck from that platysma muscle that's falling. And they want to just see an overall rejuvenation. There's absolutely no way to address that, in my opinion, without a facelift. We're really elevating those deeper structures. We're not really taking much skin because the skin comes with it. And this is a patient who didn't get a phenol peel, but you can see her environmental aging is still present even after the facelift. And that's when a phenol peel works great. Incidentally, this patient had her upper eyelids done which is not atypical when we're doing a facelift if we do some other ancillary procedures. But next slide. If you look at her from the side, she has just a really nice improvement of her neck and her jawline, and we replace some volume in the cheek area by transferring some fatty tissue. And so she just gets a nice rejuvenation of her neck and her face. But this does have more incision. She has an incision that is along the front of her ear that sort of sneaks into her ear around the tragus and then behind her ear. But as you can see, if we take our time and care, everything looks, the anatomy looks in proper position, her earlobe looks normal. And it's very difficult if we do our job for those scars to be noticeable. Next slide. Here's another patient, again, a little younger. Again, she's got a little squaring of her face, a little bit of that banding in her neck. Some people would say, oh, well, it's, it doesn't look that bad. Well, it bothers her, but the treatment is really addressing all those deeper structures, or you will not get the results you got. Next slide. So you can look here, you can see just the change of her profile, which really bothered her. You can see more definition in her jawline. And then we take the pictures where you can see their earlobes. So all those little telltale signs of facelift aren't present. And she just has a real nice result. She looks like herself. It just looks like we've turned the clock back for several years. And that's the goal of a facelift. Next slide. Here's another patient, very similar. You can see a little squaring and deepening of her folds around her mouth. Again, this is a patient that also had some concerns about her lower eyelids and her upper eyelids. But the facelift is what it's going to address, that jowling and that square face. Again, not by just tightening skin. If you watch one of us do a facelift, you really see we don't take much skin anymore. It's really about repositioning those deeper structures. Next slide. And you really appreciate the result when you look at from that profile. Her jaw and her neckline looks great. And you can see, again, her anatomy around her ear, and everything just looks very natural. And it's always a compliment to us when people who wear their hair short continue to wear it short when they've had a facelift, because they feel confident about the appearance of the scars. Next slide. Here's another patient here. Again, similar story. Next slide. You can see, again, jawline is a little bit more distinguished, and that neck angle and that banding is improved. Next slide. Oh, I thought we had several more. I guess we didn't have them in there. Okay. I think that's it with our photographs.
Thank you, Dr. Curbo. Dr. Rosenberg, would you have anything you would like to add to the information that Dr. Curbo just gave us?
No, I completely agree with everything he said. And when I see a patient, I generally prefer to do the facelift first as well, for sure. Mm-hmm. For every reason he said. The only time I would consider doing a phenol peel first is if I see someone who's really on the fence and they're not sure they want the facelift, if I think the phenol peel will get them enough that they'll be happy and then they'll decide not to do the facelift. But I agree about the prep. I think sometimes we even see patients who do the prep and they're so happy they don't even want the peel anymore. So I could not agree more about really making sure that you're on the right skincare regimen and really just taking care of your skin starting at a young age. I do think a lot of younger people are much more cognizant of that now that we really are so aware of all the detriment to laying out in the sun and tanning beds and all of those things. But I completely agree with everything he said and, echo it completely.
Another question for you, Dr. Rosenberg. Is there a specific age that you find someone is a candidate for a facelift? And does a facelift necessarily include eye surgery?
Yeah, so in general, it's when it starts bothering a patient. We see people, we're seeing them younger and younger, but I just think it depends on, what bothers them. And as we're all aware, we have plenty of patients who are in their 70s who look in their 50s and plenty of patients who are in their 40s and look like they're in their 60s. So I think people just age differently. And then it's, what bothers them and what do they want to address? We do plenty of patients, and we're all thinking, why are we doing the surgery? It's really not that bad, but it's bad to them and it really bothers them, or they notice it, or there's just something about it that really makes them uncomfortable that they want to fix. I do think we commonly do eyelid surgery or other procedures with a facelift. We're both very careful to really limit the length of our surgery and just, do it safely. But at the same time, often people who need a facelift do need their eyelids done, or they need something else done, to help complement it and address the whole aging process, because usually parts of your face, they age together. It's generally speaking, not everyone, but generally speaking, everything tends to age when one area or one part does.
And say after they come in for a consultation, Dr. Rosenberg, and they've decided maybe their mid face is okay, but they feel like they look tired all the time and they want a brow lift and an upper bleph or upper eyelids done. What would be the downtime for something if they just had that area done?
I usually say 7 days. I usually tell patients, swelling for a few days, 3 to 4 days, stitches for 7 days. And then usually if they turn black and blue, and it's sometimes really hard to predict, some people you would think they would be all bruised and they're not, others become that way. I usually say 7 to 10 days with that. And I say, returning back to normal work and activities, sometimes depending on your comfort level. I have some patients, they're going to go back to work. They don't care if they're black and blue. They don't care if they have stitches. And then, you have other patients who want to look absolutely perfect back to normal before they will be out in public again.
Right. Dr. Curbo, do you have anything to add to this segment of our discussion?
Well, I think that, like Lawrence said, I believe we're seeing younger patients that are coming in for more, for lack of a better term, a little more aggressive facial rejuvenation. I think some of that is people are using Botox and fillers, and they work great. But I think some people get a little filler burnout, and they begin to look for other options. I also think that when patients come in, they're a little younger, they're healthier, and they realize that, and they realize they'll bounce back a little quicker with any kind of surgical procedure. And the other thing I tell younger people is that many people who come in a little younger with sort of only mild to moderate changes of aging, they're not going to have a drastic change with the surgery, and they don't want a drastic change. I don't want to see a drastic change. They don't need a drastic change. And many times people may not even know they've had anything done. They'll just think they look more rested, they look healthier. And I found with those patients, many times I think the longevity of those results are longer. I'll tell a lot of patients that come in at 45, 47, and they're complaining about their neck and jawline, and we talk about a facelift. I'll tell them when they're 57, they won't have the neck and jawline they have now. Just because I think many times those folks, it's just a little bit easier to address surgically because the anatomy is in a little better position. So I just think we're seeing younger patients. I also think, as far as recovery, I think the people wearing masks is sort of giving a lot of people a courage to go ahead and do things because they stay covered up for a little while. But I just think that, we're just tend to seeing a little younger age for these facial rejuvenation cases. And I think they do great.
Yeah. Dr. Rosenberg, on that line of thought, as patients are coming in earlier in their mid 40s, early 50s to have that initial facelift, if that's what they desire, what can they expect as far as longevity or having a second procedure done down the road?
Yeah, I agree with Ben. I think in general, I tell patients you could expect a very nice change and it should last you a good 10 years. But I think in younger people, their tissue's a lot better. It doesn't have kind of the aging process that someone who's in their 60s, with loss of, structure and strength. And I feel like it does last a lot longer. I agree with Ben. And I feel like those patients, when they do come in early, can sometimes and often see a longer lasting result than someone who comes in at the age of 65, just because their tissue isn't what it used to be, just like the rest of our bodies. And I do think that makes a huge difference.
Excellent. Now, one other sort of interesting question has been posed to me is how do the two of you feel about, or are you able to do a correction if someone has had surgery elsewhere, had a facelift, possibly years past, and they want to have a touch up or have a revision? How is that something that can be addressed, Dr. Kerbo?
Well, I think you're talking about two different things. One is a secondary facelift, where someone comes in who's had a facelift and they've been very happy with it, and now they're beginning to have some recurrent problems or recurrent changes that were corrected with their facelift, and they want to see that improved again. So that would be a secondary facelift, and that's not completely uncommon, although I don't tend to see a lot of people like that. I saw my first secondary facelift that I did about a year ago, and I did her first facelift 15 years ago, and she lives in Sarasota now, and she came back up and we did a secondary facelift on her. I think you have to be careful because, we don't want people to start looking surgerized. So you have to be very careful. And I think that requires a sort of a different thought process when you're doing a secondary facelift for a lot of different reasons I could go into. Then there's the patient that come in that has really had, unfortunately, has had a really bad experience. And I tend to see a moderate amount of those patients. And I've really seen some terrible things. Most of the time we can help with those types of things. It, in my opinion, is more related to just the positioning of scars, the thought process that whoever did the original facelift went through when they did the facelift. I just saw a patient in the last month that had a facelift done elsewhere, and her hairline was raised so high in front of her ear that it was just almost freakish looking. And she wore her hair in a way where it would cover where her hairline was. I mean, that is a technical decision that the surgeon made that wasn't appropriate. We see people come in where their earlobes are pulled funny. And those are little things that a person may not be to look at them and say they've had a facelift, their earlobe is pulled funny, but they just look at them and think something is not right. This looks a little different. So we do see people like that, and I have, and I'm sure Lawrence has too, and we usually can help with those patients. Sometimes they have to be patient. I mean, we even have patients that come in that we've done micrografting for their hair because their hairline has been changed so much with their facelift wherever they had. So it's very important to make sure that the person who's doing that has done it. And you've seen, I think, a lot of pre and post-op photographs, and you feel like they're very conscious about some of the little subtle things about a facelift, because just taking someone and pulling their skin tight is not going to last. It's going to lead to a very undesirable appearance, and it's going to lead to really bad scarring. And so those are some of the things we see. And in general, we can help those folks.
Excellent. Dr. Rosenberg, I skipped a whole subject matter for you, and I am so sorry. We wanted to go over just eyelid and blepharoplasty surgeries.
Sure.
Can we do that now?
Absolutely.
Thank you.
So eyelid surgery, or the medical term blepharoplasty, applies to both the upper and lower eyelids, but you have to address the whole paraorbital. So it's the brow, the upper lids, the lower lids, and then the junctions and how they interface with the rest of your face. Next slide. Here are just some before and after pictures. This is a lady who had a lot of lateral hooding. You can see her eyelids almost rest on her lashes. And then you can see afterwards, she has a nice contour to her eyes. She just looks more awake, has a more youthful appearance. Next slide. Here you can see from the side that lateral hooding is nicely corrected. And it almost looks as though, the clock has been turned back on her, and it's done through a pretty straightforward procedure that can be done even under local anesthesia, a pretty quick, safe recovery of about a week, as we said. Next slide. Here's another lady before and after, just very heavy brows, a lot of extra skin, and then some extra fat that was taken out. And then you can see from the side what she looks like afterwards. It is important to stress, and I think Dr. Curbo touched on that earlier, is that a lot of these patients have loss of volume. And in the past, when we did these surgeries, often surgeons would just take out lots of tissue and lots of fat. And we've realized that that can really lead to an aged appearance as well. And so now it's kind of a blending of taking out extra skin, taking out fat, some, but also transposing it or repositioning it, to help kind of blend these junctions. Next slide. Here you can see her from the front. Next slide. Here's another lady, very similar, very heavy eyelids, especially out laterally. And then you can see afterwards how she just has a very nice amount of eyelid show. You don't want that show to be too much, because as people age, they can get very hollowed eyes, and it can really make them look older in the other direction. Too much skin makes you look tired and older, but too little skin and too little fat can do and have the same effect. Next slide. And here she is from the side. Next slide. Here's a gentleman who's a lot more complicated, because not only does he have extra skin that's weighing down his eyes, but if you look carefully, you can see that his eyes are almost covering his pupils. And that's called ptosis. And we do a lot of ptosis surgery. It's a tough operation because you actually have to tighten the muscle that lifts the eyelid up to correct it so that they can see better. And often this is medically necessary, and this type of operation is covered by their insurance. Next slide. Here he is from the side. You can just see the significant improvement in the contour and just the opening of his eye, the aperture. He always said people didn't realize he had blue eyes before he had the surgery. Next slide. Here's another lady. This is lower eyelid surgery. And you can see on the left before, and she had that puffiness underneath her eyes, which she just did not like. And then you can see here afterwards how nice and smooth her lower eyelids are. There's a good contour and a junction between her eyelid and her cheek, and just a beautiful result, and just very nice, smooth lower eyelid skin, and then just a very nice transition. Next slide. And here you can see her from the side. To be honest, the other side shows a much more dramatic improvement. Next slide. And that's it. Sorry.
Thank you, Dr. Rosenberg. And just as a quick recap, I know we touched on this earlier, but there's about a 1 week downtime from this because they'll have stitches for a week and some bruising for a week or so. I think that concludes our evening. We want to thank everyone for joining us. Please do remember that you can still submit questions. Send them to info-se-plasticsurgery.com, or you can do it via our secured portal on our website. Another announcement for you, which is very exciting for us this year. I know many of you look forward every year to our big holiday open house. We're doing it a little differently this year. We're very excited to let you know we have a new little twist on this long-standing tradition. I want you to go ahead and mark your calendars so you don't miss anything. But starting on November 29th and for the following 12 days, we will celebrate our patients and our community with 12 days of holiday treats. So be sure that you subscribe to our newsletter. That will keep you updated on all the details of this new and exciting venture that we're doing on our holiday tradition this year. Thank you so much for joining us. And like I said, be sure to submit any questions. We will certainly follow up on those. Have a good evening.